My name is Beau Whitaker, and I'm a veterinarian at Brazos Equine Hospital in Salado, Texas. We're a large equine hospital. We have 8 veterinarians at our location in Salado. It's a partial referral hospital. We do mainly sports medicine, also surgery as well, and my specialty is sports medicine and rehabilitation. Suspensories are probably the most common thing that we deal with, both bodies and branches. We also see quite a few deep flexor tendon injuries, crucial flexor tendon injuries, as well as some inferior check ligaments. And then we've got other ones that we see that are less common than those, but those will be the most common ones that we see. Well, the biggest concern is re-injury once that is healed. So that's one of our main goals, is to get that horse back into work, and however long that might take, and have that horse, once it goes back, not to have to get re-injured and have to take time off again. So the biggest goal is to prevent re-injury. That's kind of a loaded question because a lot of variabilities can play into what happens there. So it just depends on the injury, the structure, and how bad it is. So you might have a very mild tendonitis in the superficial flexor tendon. That horse could be back in as little as maybe 1 to 2 months if it's really mild, versus some of our more severe deep flexor injuries and some of our more severe suspensory injuries may take up to a year sometimes. Sometimes they're obvious. If you've got a big old hot swollen area on a leg, then you ultrasound that area and find the lesion. Sometimes, like in proximal suspensories, they're a little bit harder to detect. So in those cases, typically we'll do a lameness evaluation. That would include nerve blocks or joint blocks as well. Try to diagnose the location of the pain, and then do further diagnostics from there, typically an ultrasound, obviously, to diagnose. In some cases, we can't diagnose. We end up with an ultrasound or x-rays. We end up having to do an MRI to get a correct diagnosis on that. Most of my regenerative therapy was experienced prior to Regenaflex, was with PRP and stem cells. I'd used both of those for quite a few years prior to trying Amnion. As far as other products that are similar to Regenaflex, I had used a human-derived Amnion product for a year or two prior to starting to use Regenaflex. And I was pretty comfortable with Amnion products at that point. I'd also, for about 15 years, been using Amnion membranes for wounds. We would harvest our own Amnion membranes from mares that we would pull up the clinic, and then process them and freeze them and use them on the wound. So I was a really big believer in the regenerative qualities of Amnion, just because I had seen it myself with 15 years of experience in wound care, and also using it on corneas, healed corneas as well. So I was really comfortable with it prior to that, and I've also been using it in soft tissue injuries and in some joints as well with the human-derived Amnion products. Well, I've been using it for probably maybe close to 2 years now, and it's been really great. As I said, I already had a comfortability with Amnion in general, Amnion-type products and in general birth-derived products. And so I started using it initially in lesions and tendons, core lesions, injecting it lesion ultrasound guided, and was just really seeing remarkable results as far as those tendons healing and those lesions filling in. Then I started using it in other ways too. I started using it some more articulately in some joints and periarticulately. It was just kind of trying different ways to see how it was most effective and what injuries it was going to be most effective in. Well, I like the consistency of the product. I've gotten a little bit frustrated sometimes using some other biologics, especially in lesions within tendons, like core lesions, things like that. Because I might treat a horse one time with PRP that, obviously it's harvested from that horse an autologous product. And one time the horse would go great, the next time I wouldn't get the same results, or very different results. And so it'd be inconsistent. I would also sometimes see that with stem cells as well. So what I like about it is I felt that I got really consistent results that I could at least somewhat predict what was going to happen with that, as long as I was able to control the rehab part afterwards, which is also just as important as, probably more important than what you put in it, what you do, of course, after that through the healing phase. But as long as I can control those factors, I felt like I know what I'm going to get with Regenaflex. I don't know that I had concerns with Regenaflex in particular, because I'd been using other products, other kind of similar products prior to Regenaflex in the same way. So I already had some experience using it quite a few horses prior to trying Regenaflex. So I really did not have a whole lot of concerns as far as afraid to use the product because I already had a comfortability with that general class of biologics. Well, for me, it's really going to be, most soft tissue injuries. That's going to be something I'm going to consider, especially if it's a core lesion. So if I've got a hole in a tendon, almost every time I'm going to use Regenaflex. And the reason for that is just, like I mentioned before, I've just seen really consistent healing in those cases. Also, we'll use it periligamentous or peritendinous. If I don't have a lesion to inject into, I will inject it around the soft tissue injury as well. And I've had good luck with that on suspensory branches. That just kind of some of those inflamed, acute, chronic suspensory branches. It's worked really well on some of those as well. So anytime I've got a tendonitis, or ligament tendon type injury, that's usually going to be at least probably the first thing I'm looking at. So I've used it intra-articularly and also around the joint. There's been some horses that had some flares, some inflammation. We've been working on, the company's been working on altering the product some to get rid of that. And so far they've been really successful. The products I've used recently haven't had any issues as far as that goes. So I'm really encouraged that they're really developing a good, consistent joint product.